Hello?
Hi, Pauline.
Hi. Hi. So, I'm here with Christoph. He's coming in 2 seconds. We're connected. We have the screen. We have it on my computer.
Okay. So, thank you very much, Pauline and Christoph, for joining us. This is Deb Derrick. I'm president of Friends for the Global Fight, and I'd like to thank everybody on the phone for joining us for today's presentation. We are delighted to have Dr. Christoph Benn of the Global Fund joining us from Geneva today, and we hope and expect that this will be the first in a series of webinars that Friends of the Global Fight will be putting together this year to help explain the Global Fund to all of us here in Washington, D.C. This is, as you all may know, a pivotal year for the Global Fund with a replenishment effort happening this fall. And we're coming off of some really excellent news with the U.S. government and the President's request of $1.65 billion for the Global Fund. And I know many people on the phone helped to advocate for that, and thank you for that. And we're very excited, too, to have just finished a replenishment kickoff meeting in Brussels last week. So, again, I'm excited to have Dr. Benn with us today. He is the Director of External Relations at the Global Fund. He is a physician with special training in tropical medicine and public health. And he has spent several years as medical superintendent in a hospital at the Lutheran Church of Tanzania as a coordinator of an AIDS control program there. And he is a great resource and has been a terrific colleague to Friends of the Global Fight and to many of us here in Washington, D.C. more generally. So we've asked Christoph to speak this morning about 3 different topics. And the first one will be a very quick update on the new funding model and its rollout. And then an update on the recent needs assessment, the document which the Global Fund put together in conjunction with its partners, UNAIDS, Rollback Malaria, and Stop TB, to determine how much money is needed to contain the 3 diseases, AIDS, TB, and malaria. And then finally, Christoph will be talking about the upcoming replenishment, the meetings, and the efforts along the way. Before we get to Christoph, I'd like to go through a bit of housekeeping. We have a fairly large number of people on the phone, and so as you all may have already discovered, your lines are muted. So instead of getting people's input through verbal input, we're going to have things coming across electronically, and then we'll do the translation of questions to Christoph on your behalf. Hopefully, you have all been able to access the slides that are coming up online. If anything isn't working correctly, please click the blue question mark in the upper left-hand corner of your screen, or if you send us an email, we can get back to you and see if we can help you out. We will be making, as noted, we'll be making this an interactive session today, but rather than verbal questions, it'll be written questions. At any point during the presentation, you can submit an anonymous question, and you go to the right side of your screen and click on Submit Questions Here, and you send a message with your question or feedback. And we'll be taking as many questions as we possibly can, given the time constraints. On the content, as you all know, last fall the Global Fund Board approved a new funding model as part of a larger transformation process at the Global Fund. And I just want to make the rollout of the new model began earlier this spring, and we're going to have Christoph give a bit of the news about this new model and walk us through some latest updates. Just to back that up a little bit, for those of you who are not as steeped in the Global Fund as some of us are, the new funding model, from my point of view, one of the key aspects of it is that it allows for a more iterative and interactive relationship with programs on the ground. The idea is to bring the new science to bear and to allow for greater input as countries are developing their concept notes or their grant proposals, so that by the time they get to the Global Fund, they've already been shaped up and there's been a lot of discussion on the ground to helpfully expedite the new funding model. So with that little bit of background, I'm going to turn it over to Christoph for a bit of a quick background on the new funding model and where we are with that. Over to you, Christoph.
Thanks a lot, Deb, and thanks to you and the whole team at Friends for organizing this call. Very happy to talk to you, and thanks for all of you who have joined this call for your interest in what we are doing and in the Global Fund Replenishment. And let me also use this opportunity to thank all of you on the call for your great support in making this amazing announcement possible that we had last week. It was obviously the best possible situation to conclude the replenishment meeting in Brussels with the announcement of President Obama's budget request for FY14 of 1.65 billion. That's almost the perfect start into a replenishment campaign, and I know that a lot of hard work has gone into that. It required really a very concerted effort of many advocates and supporters, and it has worked, and we are enormously grateful to all of you who have played a role in that. So thanks for that, and with that then I'm happy to move on to the first part of the presentation on the new funding model. And I hope you have all the kind of slide on the screen overview of the new funding model. But let me indeed give you a little bit of the background, for all of you who have not followed the processes so closely. The new funding model is a key element, actually cornerstone of the reform process of the Global Fund. When we've been trying throughout the last year, 2012, to adapt the Global Fund to the new environment, to make it fit for the future, and to provide countries with a much more predictable and simplified process that is based, as Deb mentioned, much more on dialogue, on an iterative process. Many of you will have been familiar with the previous rounds model, which had certainly also its advantages, based on competition between countries and CCM submitting their proposals, and on a merit-based foundation. But it had also the clear disadvantage that on average 50% of the applications were rejected. Countries had very little predictability and visibility of the funding stream that they could expect, and also it meant that they put a lot of work into the submission of these proposals, often with the help of consultants, and then there was just a yes and no. There was no way to go back and improve and have a dialogue, and to link it also to the existing country plans and strategies. So this should all change with the new funding model that we have. It has been launched in February, end of February actually, and it is also very fitting that we talk about this here on this call, because it's also extremely important for the replenishment. Because you can imagine that many donors are watching carefully how we are rolling out the new funding model. We've made close to $2 billion available for the first phase of this new funding model, and it is extremely important that this phase will go well, that there is positive feedback coming back from the countries themselves, and that it is recognized that the reforms are working. It's getting easier and more predictable for the fund, for the countries to work with the Global Fund. So therefore, while it is really the kind of cornerstone of our operational aspects, it is very important also for the replenishment overall. And the slide shows you the process. Wherever possible, it should be based on national strategies. It has this characteristic of introducing a country dialogue, which is important to note that it's not a kind of global fund dialogue where we go in and initiate a dialogue. Wherever possible, we want this dialogue to be based on existing country dialogues involving all the partners from the government, from civil society, from multilateral partners. So that is the process to develop the best possible concept note for the country. That should take into account all the information that the country have. It should take into account the full expression of the demand and of the need at the country level. and that will be submitted. It goes to our technical review panel, so we'll still have the kind of independent review, then to our internal grant approval committee, and finally to the board for approval. So that's the process that we are following now, and we've identified a few countries that are the so-called early applicants that go through this full process already. And then we have a number of interim applicants this year, and after the replenishment, and after we know how much money we'll have available for the next 3 years, then it will be rolled out, for all eligible countries of the Global Fund. So on the next slide, you see that, the invitations have gone out to 50 CCMs, and all of them have accepted to participate in the new funding model. We have identified 3 early applicants, El Salvador, Myanmar, and Zimbabwe, that have already submitted their concept notes. The country dialogue has already happened. The teams went out immediately after the launch in March to the countries, had the country dialogue, and the concept notes have been prepared. This is very encouraging. Also, what I've heard from some of the countries, that it worked quite well. And we hope to sign the first of these grants by the time of the June board meeting. And that will be a very important milestone. Another set of 3 early applicants, DRC Congo, Philippines, and the Mekong Artemisinin and Resistance Initiative, is aiming to complete the concept notes by October. And then the interim applicants that do not have to go through the full process, but they have received the indicative amounts that they can expect for the 3 diseases, and they submit their applications that will be considered over the next couple of months. And we already have, Pakistan with its funding request already been submitted in March, and 5 other countries that plan to submit by May. So the process is underway and working already in a couple of countries. Next slide, please.
Next slide. Yeah.
Yep. All right. So that concludes my very brief, comments on the new funding model. And I think, Deb, we open up for a first round of questions on this first topic.
And this is Deb. While we're waiting for people to submit questions, I'll ask just a couple, Christoph. So, sure. In terms of the first 3 countries and so on, if you're expecting the concept notes to be approved at the board meeting in June, then how quickly do you anticipate the programs will be off and running on the ground? So if they sign it, does a check get cut immediately, or is there something else that happens after you sign a concept note?
Thanks. That's a great question. Actually, we are talking basically about disbursement-ready grants that the board should approve in June. So the intention is that basically soon after the board meeting, we could make the first disbursement. So certainly, for these 3, but hopefully also for a number of others, we can make the disbursements this year so that the money is flowing.
And just one follow-up. And in terms of the other interim grants that are available, not the early applicants, but the other ones, the others, I think you said it was 50 countries, those applications can go through a concept note development. How much appetite have you seen among countries for diving straight into concept note type of process versus just the old process of having them develop a grant and submit it, or a proposal and submit it to you?
I think that there is significant appetite for the new way of preparing these applications. Even if the interim applicants don't have to go through formally a country dialogue phase, but our teams are visiting those countries as well, and having these calls. The concept notes are a little bit simpler than what the full applications used to be. It's just important to note also that for a number of the interim applicants, this will be part of a reprogramming or a phase 2. So that's why they wouldn't need to kind of go into a concept note development as for the early applicants.
And Christoph, we've gotten one question that's come in. What do you see as the prospects for expanding the tuberculosis portfolio within your plans?
Mm-hmm. Right. I mean, I know that there has been a lot of concern in the tuberculosis community, and I fully understand why. The board had decided that there would be a kind of for this first phase, there would be an indicative allocation for the 3 diseases based on the historical share. And the historical share, used to be 16% for tuberculosis, but as that meant, for disbursements in 2013 and 2014, and as tuberculosis had been higher than the 16% over the last 2 years, which still has consequences, I mean, in terms of commitments and approvals, it meant that what they received in allocation now for this first phase would lead then to a 16% share for 2013-2014. It was always clear to us that this needs to be redefined. It should in the end also depend on the countries to determine how much money they want to go for which disease. I understand all the concerns of the TB community, but it certainly is no indication of a reduced importance of tuberculosis in our portfolio, or that we don't see the need for tuberculosis funding. Just the opposite, and I hope that we've been able to clarify this after the significant irritation that we could sense after the launch of the new funding model.
Thanks, and we got another question here, Christoph. One of our listeners would like to know if there have been any early lessons learned from the participation in civil society in the country dialogue thus far with the early applicants.
Right. I would say it's still a little bit early days. I mean, obviously, the whole purpose of this process with the early applicants is to review them, to learn lessons from this phase, so that we can then hopefully improve on that for the full rollout after the replenishment. But at the same time, from the few examples that we now have, Zimbabwe, for example, I do believe that it has proven that civil society has been playing a strong part in that, and we certainly from the Secretariat, pay a lot of attention to that. It's very much on our mind. There has been training for the teams that go out to the countries and do these dialogues, and it is very clear for us that the success of the model, and as we will review it later in the year, will depend to a significant degree on how much we succeeded to maintain our multi-stakeholder approach that has always been a hallmark of the Global Fund, and so we do everything possible in a sense to keep that.
Great, and I think we'll move on to the next section of our discussion and start talking about the needs assessment that was recently published by you all. So last week in Brussels, at a meeting kicking off the Global Fund's 4th replenishment effort, which an effort that happens about every 3 years, the Global Fund's leadership shared the outcome of a recent so-called needs assessment, and it was undertaken with the help of technical partners to determine how many resources were needed globally to contain and confine AIDS, TB, and malaria. The study looks at progress to date on the 3 diseases, and again, what will be needed to keep up the fight. So over to you, Christoph, for a discussion of the needs assessment.
Thanks, Deb. So, before turning to the actual needs assessment, you see here on the screen a short snapshot of the results to date. because that is also very important for this whole argument. When we made the presentation in Brussels, we could not move straight to the needs, but we had first to do a presentation on the results achieved with the investments that the Global Fund has made, and that's the basis also to have the confidence that we will be able then to scale up through this replenishment. So that's why you see that here, and that reflects what we showed to all the donors in Brussels. You see not only the kind of 3 high-level indicators on people on ART, currently 4.2 million, close to 10 million people treated for TB, and the more than 300 million bed nets distributed. But very important was to show to the donors also the increase over the last couple of years, that they could see the acceleration of that, because it also proves that there is indeed capacity at the country level to implement these initiatives, and that is very important for them to see. And maybe then we turn to the next slide that shows the progress made, and that again was in our paper for Brussels, that they could not only see the kind of input and output, but really also now the impact in terms of reduction of mortality, and we all believe, I think, that these figures are very impressive if you look at the last 6 years, and the decrease in AIDS-related mortality by 24%, and TB declined 41% since 1990. Malaria mortality decreased by 26% between 2000 and 2010, and even more, by the way, on the African continent. So these are all very impressive figures that, again, we put in the paper as the foundation to the request now that we made to the donors for the next 3 years, for 2014 to 2016. And that leads me to the methodology that we've used to produce that needs assessment on the next slide. It has been a very collaborative effort with our technical partners. We work very closely with WHO and their AIDS, TB, and malaria departments. We work with the Stop TB Partnership, Rollback Malaria, with UNAIDS and other partners. But not only did we collaborate very closely with them, but we also wanted to know how much do the numbers that they have in their kind of global plans reflect the needs at the country level. So there have been workshops at national levels, again with partners, getting together representatives from all the high burden, high impact countries, and all of that was also supported by the Bill and Melinda Gates Foundation. So we felt that we had a pretty thorough approach to that, because for the resource mobilization, it all depends also on the credibility of the numbers that we provided. There were a number of additional aspects that were important here. As I said, it was supposed to provide a realistic reflection of country needs, but also a realistic projection of the domestic funding, because that has been the major change since the last replenishment, that implementing countries have increased their domestic funding significantly. You're probably aware that last year was the first year that domestic funding for AIDS, was more than the international funding. And we also tried to calculate, how much more that would increase over the next couple of years, how much that would accelerate based on the data we had from the countries. So that went into the calculations. We also took note and then included all the information we had about new drugs, new diagnostics, for example in TB, new guidelines coming out from WHO on AIDS treatment, so that all of that was reflected in the calculations, as well as developments on costs for commodities and projected costs, for the next 3 years. So that was basically the methodology that we employed, and that will lead to the resource needs that you will see on my next slides. I could stop here for a second if there are any questions so far.
Thank you very much, Christoph. So in terms of the the assessment documents, was there anything substantially different in the way you approached it this year from 3 years ago, let's say, in terms of how you did your calculations or who you consulted with? Was there anything, or is this just a standard procedure for the Global Fund? Was there anything different, or was the science different?
Well, yes and no. I mean, it was not different in the sense that we also had worked with the technical partners very closely before. But yes, I think we had more, country workshops, trying to get data directly from the countries, and to do that in a different way, because again, here we have to consider that we don't have rounds anymore. We have the new funding model. In previous needs assessments, we often tried then to estimate the size of upcoming rounds during that replenishment, and that is very different now. So therefore, we went to the countries, looked at their existing plans, their future plans, with these modifications, as I said, new developments, new drugs, new tools. And then the other thing that has really been different is the whole calculation on domestic funding. I mean, that has certainly not been there, certainly not as prominent as it has been now, and also playing a much bigger role in the whole share of the needs, as you will see on the next few slides.
And I know that when Mark Dybel was here in February, he gave some significant amount of attention and time to the new scientific developments, and you mentioned that too. Are there some that really jump out at you as being especially new, noteworthy, or impactful on the needs assessment and the calculations that you did? Like, what are the big developments that then drove the needs or increased needs?
I would say, on the needs assessment, the most important developments were the inclusion of the effect of new tools and so on in terms of diagnostic and drugs. But what we presented in Brussels, as well as I mentioned in this session on the science, was more kind of new epidemiological science, for all three diseases, that told us that we can probably be much more targeted and effective with our future interventions together with partners at the country level. That means we have now more information about where the so-called hotspots are, the areas of the highest transmission rates, because we know quite a bit about the concentrated epidemics in a number of countries, particularly on HIV. But what has been more new to kind of us and other partners is that you also find that in countries that were classified as having generalized epidemics, but even there you find big differences between different population groups and geographic areas. And if you take that into account and really focus a lot of money and interventions on those areas, we think we can have a much higher, bigger impact actually on transmission rates and incidence and finally infection rates. So that's what was presented by Tim Helland, but also by our partners from UNAID, Stop TB, Rollback Malaria, and was actually quite impressive, I think, also for the donors to see how much we think we can achieve over the next few years.
Great. So basically, some of the information really pointed to increased cost effectiveness of the investments then. And we had one question that came across asking whether or not the needs assessment includes new tuberculosis drug formulations. Well,
as I said, we took all of that into account, although the new drug that has become available now, that's really a new drug for the multi-drug resistant tuberculosis, and we did take that into account for the calculations on MDR TB. For the kind of non-drug resistant tuberculosis, we will continue to rely on the proven treatments as recommended by WHO. So yes, we took into account the new drug development, but it's more relevant at the moment for the multi-drug resistant tuberculosis.
Great. And let's then, I think this is a good point to lead into the replenishment discussion. So as noted earlier, we're going to turn our attention to this replenishment meeting, which is scheduled for this fall. And Christoph, if you could, would you walk us through your hopes or the hopes and plans of the Global Fund around the upcoming meeting and what we can all expect?
Sure. So now you see on this slide the forecast of total resource needs for the three diseases for the years 2014 to 2016. So a total of 87 billion, and then you see the breakdown for AIDS, TB, and malaria. And if you look at the column on the right, you see the composition of the 87, the existing domestic resources, the additional domestic resources that we expect over the next 3 years because of the acceleration and increasing the health budgets in a number of countries. Then you see the 24 billion representing the external financing not coming from the Global Fund. That's currently 8 billion per year, and we kept it, steady at that level. And if you put all of that together, then you have a remaining gap of 26 billion out of the total need of 87 billion. And then we took the 26 billion and we looked at the share of the Global Fund based on the historical share of the Global Fund in fighting these three diseases, which is particularly high in tuberculosis, very high in malaria, and very significant in HIV/AIDS, but less dominant. And if you apply those shares to the 26 billion, then you come to a Global Fund share to close that gap of 15 billion. So that is our Global Fund's ask to the donors for this replenishment. We have not come out with any scenarios this time. We have only one number. It's the 15 billion number. That's our goal for this replenishment. And that's what we presented to the donors with this justification and with the narrative that I just described. And I would like to walk you a little bit through what kind of impact that could have, because that's the whole point in a sense. Money in that sense is very theoretical, but it's important what you could get for the money. And let me just walk you through the three diseases. If you look at that with the Global Fund contribution of 15 billion, it's estimated that together with the other resources that I indicated from domestic funding, other external funding, that could get us to cover 87% of the global resource need. And it would result, together with investment of others like PEPFAR, other bilaterals and domestic funding, to being able to put 18 million adults on antiretroviral therapy by 2016. And that already takes the implementation, the early implementation and rollout of the new WHO treatment guidelines that will be issued later this year. When you come to tuberculosis, you see that with that level of investment, you could get to an 86% share of the global resource need. It would result in treatment and care for 17 million people with tuberculosis and MDR-TB by 2016. Actually, that would translate into saving 7 million lives. And finally, on malaria, it would lead to an 85% share of the funding need, and, for example, would save an additional almost 200,000 lives per year during the 2014 to 2016 period. So this is really very kind of exciting news, I would say, because if you get to that coverage, and that was our main argument also to the donors, then you come to a tipping point where you can really talk about defeating the three diseases, on controlling the three diseases, on entering the end game on these diseases, because these are coverage levels that can have a real impact at the population level. So that's the kind of exciting news coming out of that, and you see here that we made a very strong point to the donors in Brussels that we are at a crossroads here. We are at a historical moment, if you like. We can accelerate progress to save millions of more lives, but really then, control the diseases. Or if we don't do that, then we risk also the gains that we've already made against the 3 diseases. And we made that alternative pretty clear to all the delegations that were present in Brussels. And that's really then the message for the upcoming advocacy campaign, if you like, because now the numbers are out, the needs are clear. The U.S. President's budget is out, and now we are doing a very extensive outreach to all the donor countries around the world, trying to mobilize the resources that we can meet those needs.
Thanks, Christoph. Just one point of clarification, just because I was looking at the chart that you had in your forecast of total resource needs, and just to I think you said it verbally, but the lower dark blue, that was domestic resources, right? And then above that, it gets into the additional domestic, because I didn't see the key to that.
The 23 billion was the existing domestic resources as they stand now, and we are, anticipating an additional 14 billion, from domestic resources.
Great. I just wanted to call that out.
Yeah.
Thanks. And we had a question that says, what's been the initial response from the donors to the request from the Global Fund for $15 billion out of the 87 total assessed needs?
Very good question. I did not see anybody to faint, at the table. And I could tell you, if a little while ago, if we had presented just a 15 billion number, they might have thought you're out of your mind, because you don't know the budgetary reality in our countries. And that's true. We know that, many of the donor budgets are under severe pressure and constraint. But no, that was not the response. I think, from the feedback we got, they took this very seriously and said, well, it's a big number. We have to get back home and have discussions on that at home. But nobody said this is completely ludicrous and impossible. So I took that as a positive sign.
Great. And was there, I guess the U.S. number came out toward the end of your meeting. Was there any general discussion of that came out?
No, because it was really, as we concluded the meeting, and probably in the corridors and at the lunch after that, there were discussions around that, but not in the official meeting. I could sense that, some had already anticipated something like that, so I don't think it was a total surprise for everybody around the table. There was certainly a lot of, that's a big commitment, but there was no formal discussion on that.
And another question came in, why did the Global Fund only aim to ensure that 87% of the global resources needs were met?
We were not aiming for a particular percentage number here. We took it from the total resource needs, from the 26 billion gap, then to define what's the Global Fund share, and that share happened then to lead to a coverage of 87% if we mobilized the 15 billion. So we did it that way around. It was not that we set a particular target, 80, 87, 90. We were deducting that from the total needs, and it turned out that it was this percentage number.
And we got a question that someone in the audience was listening to your explanation of where you got the $15 billion, but it's still not entirely clear to them. where that number comes from. Could you possibly re-explain that, where you got the $15 billion request for the Global Fund itself?
All right. So then again, we have to go back to this slide with the columns, and then let me go one step further back. I mean, all the total needs numbers for the 3 diseases came from the disease partners. So agreed, global plans, as in the case for TB and malaria, published plans that had these resource needs that our partners had estimated and published. In the case of UNAIDS, it was building on their previous work, on the investment framework, on also agreed target numbers at the high-level session in the UN in 2011. So we basically always took the kind of internationally agreed targets and plans, and then applied that to the total that you see here, the kind of $87 billion. And then, as I explained before, and the first step that I haven't mentioned was then we applied those total numbers to the countries eligible for Global Fund support. That's an important qualification because not all countries that are necessarily in the global needs assessments from the partners are eligible for Global Fund support. For example, upper middle income countries with a less than high disease burden would not be eligible, for example. So that was deducted first, and then we applied the formula that I explained with the domestic funding, the other external funding, and the remaining gap.
Great. And we also had a question about what is the relationship between the domestic funding and the new funding model?
There is an important relationship because the model with the country dialogue offers more opportunity for including domestic resources in these discussions, also to stimulate further increase in domestic funding, because we never had this kind of interaction. We got only the applications after they were approved by the board, after the board had said yes or no. And that was far too late then to discuss, and what kind of domestic resources do you have, or what are you planning to kind of include. So I think the new funding model offers much more opportunities here to see really how can we together fill the gap that exists, that has been identified, and where you have your own domestic funding, where you already have indications of other donors of what you might receive, and here's the remaining gap, and here's what you can apply for with the Global Fund.
Great. And I know, too, that there's been some discussion among various partners about breaking down the $15 billion request and exactly what that figure would buy for you if you're talking about what the Global Fund can sort of provide to the world with that contribution. Do you all have some data on that you could share, or could you put some together that we could all use?
Yeah, I mean, as you know, these few slides that I've presented to you are based on the much more extensive papers that we produced for the replenishment and that you find on our website. So I recommend to any of you who is interested in more details, go to our website, look at these papers, particularly the needs assessment paper, and there you will also find some more information, on what these amounts of money would buy. I gave you a few indications in terms of numbers of people we can put on ARVs or number of patients that we can treat for tuberculosis and so on. But you will find more information on that in the paper, and we will certainly also continue to work with our partners on that. You have also some interesting numbers in the paper, what kind of level of coverage it would lead for specific interventions. For example, bed net distribution in Africa, that this level of funding would get us to, the more than 80% coverage there, which is absolutely critical to interrupt the transmission. for malaria and so on. So you have some more information in the paper.
Great. And for anybody who hasn't gone through a replenishment effort, could you give just a general sense of the activities that are likely to happen over the course of the next several months leading into the fall and the replenishment? What will you all be focusing on in particular in your section of the Global Fund?
Right. So I think, as I already indicated, now after the meeting, there's a very intensive period going donor by donor, partly through visits to address all their kind of individual questions, concerns they might have. It is also the phase for intensive advocacy. We've been mobilizing a number of heads of state from Africa, for example. We have the support of the Secretary General Ban Ki-moon as our co-chair, and of other prominent supporters. We are trying to enlist the support of, governments donor governments that have been strong supporters, that they reach out to other donor governments. So all of that will be, particularly important, I would say, over the next 2.5 months.